Have you ever experienced the fear of having a zombie-like creature eat the skin off your body? I'm assuming the answer is most likely no. That is unless you were an actor in one of the thousands of zombie movies that have been made. And while you should have no fear that you will fall victim to a zombie outbreak, there are other flesh-eating situations that you should probably know about. Namely, a condition called necrotizing fasciitis is what I will be discussing today. Necrotizing fasciitis sounds quite complicated at first glance, but let's break it down. The word necrotizing comes from the word necrosis, which is defined as localized death of living tissue. The root of the word fasciitis is fascia, which is a thin casing of connective tissue that wraps around organs, bones, blood vessels, nerve fibers, and muscles, holding them into place. And finally, the suffix itis means inflammation, so fasciitis is inflammation of the fascia. Now that we have broken down the name a little bit, let's get more into what necrotizing fasciitis really is. Necrotizing fasciitis is an infection caused by bacteria, namely streptococcus that are known to cause strep throat. Bacteria are microscopic organisms that, while living all over your body from the depths of your gut and bowels to the surface of your skin and hair, can still make you very sick, and they are also commonly referred to as germs. These bacteria can get into deep tissue of the body via breaks in the skin. These breaks in the skin can be a result of a minor injury in the skin, like a bug bite, a cut, or even the site of an injection. Another way could be the result of surgical complications. Once the bacteria is in the deep tissue, it spreads by way of the fascia and produces other molecules, such as endo and exotoxins, that restrict blood flow to that tissue. Blood, on the other hand, is a connective tissue and the carrier of many necessary substances in the body, including oxygen and molecules that fight off infection. When this blood flow is restricted, the body is unable to fight off the infection of the tissue. As a result, the tissue begins to develop a rotting physique and it begins to die. Since it is crucial for the body to fight off the bacteria, people with immune disorders such as diabetes or kidney disease can be more at risk for developing necrotizing fasciitis. Now, you may be wondering how to know if you have necrotizing fasciitis. That is, without having to wake up only to find your arm in a zombie-like state with the skin on your hand rotting away. Necrotizing fasciitis is a condition that presents itself very quickly after the infection occurs, usually within a matter of hours. The symptoms can often resemble the flu at first, resulting in a fever, sore throat, stomachache, nausea, diarrhea, chills, and body aches. There are also symptoms on the affected area, such as pain or tenderness, redness, swelling, discoloration, ulcers, and blisters. The affected area may also be hot to the touch and even appear shiny. In serious cases, organ impact could lead to shock and sometimes death. Now, you may be a little scared after learning what necrotizing fasciitis really is, but rest assured that less than 1 in 100,000 individuals in the United States get necrotizing fasciitis each year. Diagnosis usually is made solely off the patient's medical history and the symptoms they have. However, there are some tests or imaging that can be used for diagnosis, including white blood cell count, MRI, or biopsy of the tissue. Typically though, diagnosis is made almost immediately based on the symptoms presented. This is due to the fact that quick treatment is crucial to recovering from the disease. Treatments can include antibiotics administered via an IV, and surgery for dead tissue removal. Surgery, amputation, or removal of organs are always considered options to stop the spread of this fast-acting, aggressive disease. While this is not a common condition, it is still very important to be aware of because of its deadly nature. Now, I'm sure you must be wondering how necrotizing fasciitis is spread. Necrotizing fasciitis is not commonly spread from person to person, but it can be if the wound is in close contact. In some cases, individuals who have been around somebody with necrotizing fasciitis will be prescribed an antibiotic for prevention. The bacteria that cause necrotizing fasciitis can live in bodies of water, so if you do go swimming with an open wound, it is possible to contract the disease. To avoid developing necrotizing fasciitis, proper hygiene and wound care should be practiced. For instance, keeping wounds clean and practicing good hand washing are always great ways to prevent bacterial infection. So the real question is, what is the survival rate or mortality of this disease? Survival rate depends on various factors, including the type of bacteria causing the infection, location of the infection, and how impactful the treatment is. If it is not treated, there is an inevitable 100% mortality rate. However, if treatment is given, there is a higher chance of survival, around 75%. Thank you so much for watching our overview of necrotizing fasciitis, and here's a summary of some of the things that we went over today. We aim to have left a lasting memory of what the disease is, how it is spread, and, most importantly, how it is treated. Above all, we hope that you have a better understanding of the differences between a zombie attack and a well-realistic flesh-eating disease.